Welcome to our channel. Today we're diving into some crucial information about tuberculosis or TB. TB is a serious infectious disease, but with knowledge we can empower ourselves and fight back. Let's get started. TB is caused by a bacterium, kind of like a very tiny organism called Mycobacterium tuberculosis. Think of it like a little troublemaker hiding in plain sight. This bacterium spreads through the air, just like a cold or the flu. However, it's not as easy to catch as those. You typically need close and prolonged contact with someone who has active TB, like spending a lot of time in the same room with them to get infected. Good news is, you can't get TB from sharing food, drinks, or casual contact. That means a quick handshake or a hug is okay. Now, there are two main types of TB: latent TB infection and active TB disease. Let's break those down. Latent TB, or LTBI, means you have the TB bacteria in your body, but they're like sleeping giants, chilling out and not causing any harm. You won't have any symptoms and you can't spread it to others. However, if LTBI is not treated, it can wake up and become active TB, which is when the real trouble begins. Active TB is like those sleeping giants are now wide awake, causing all sorts of symptoms and, unfortunately, becoming contagious. So what are the signs of active TB? Well, it often starts with a persistent cough that just won't quit, even after several weeks. This cough might be so bad that you cough up blood or phlegm, which can be scary. You might also experience chest pain, feeling like someone's sitting on your chest, making it hard to breathe. Along with that, active TB can really drain your energy, leaving you feeling super tired and weak all the time. Other symptoms include fever and chills, those night sweats that soak your sheets, loss of appetite, and unexplained weight loss. If you experience any of these symptoms, especially that persistent cough, it's crucial to see a doctor right away. Chapter 4. Who is at risk of TB? Now, while anyone can get TB, certain factors can increase your risk. For instance, if you have a weakened immune system, like those battling HIV/AIDS or living with diabetes, you're more susceptible. Also, if you've been in close contact with someone who has active TB, your risk goes up significantly. Think about it like this: the more exposure you have to the bacteria, the higher your chances of getting infected. Additionally, living in or traveling to areas where TB is more common, like parts of Asia, Africa, and South America, can increase your risk. Finally, people living in crowded or poorly ventilated environments, like prisons or homeless shelters, are also more vulnerable. Chapter 5. Diagnosing TB as tests and procedures. Diagnosing TB is crucial for effective treatment and preventing its spread. There are a few different tests doctors use, and it often starts with the tuberculin skin test, or TST. In this test, a tiny amount of TB antigen is injected under the skin of your arm, and then a few days later, a healthcare provider checks for any reaction like swelling or redness. Another test is the interferon gamma release assay, or IGRA, which is a blood test that checks for your immune system's response to the TB bacteria. In some cases, a chest X-ray might be done to look for any signs of lung damage caused by TB. And finally, a sputum test, where you cough up mucus, can be analyzed to see if the TB bacteria are present. Chapter 6. Treatment options for TB. The good news is, even though TB is a serious infection, it's treatable and curable with the right medications, specifically antibiotics. The type of treatment depends on whether you have latent TB infection or active TB disease. For latent TB, you'll typically take 1 or 2 antibiotics for a period of 3 to 9 months. This helps prevent the sleeping giant from waking up and becoming active TB. Active TB, on the other hand, requires a combination of multiple antibiotics taken over a longer period, usually 6 to 12 months. Chapter 7. Preventing TB vaccines and precautions. Prevention is key when it comes to any disease, and TB is no exception. One of the most effective ways to prevent TB is through vaccination, specifically the BCG vaccine. This vaccine is usually given to infants in countries where TB is common. Now, even if you've been vaccinated, it's still essential to take precautions, especially if you're at higher risk. This means avoiding close contact with people who have active TB, ensuring good ventilation in crowded places, and getting regular TB testing if you're in a high-risk group. Chapter 8. TB's global impact, a worldwide concern. TB isn't just a problem in one part of the world, it's a global health concern. In fact, TB is one of the top 10 causes of death worldwide, which is a really scary statistic. Every year, millions of people fall ill with TB, and sadly, millions lose their lives to this preventable and curable disease. The regions hit hardest by TB are often those with limited access to healthcare and resources, such as parts of South Asia, Sub-Saharan Africa, and Southeast Asia. Chapter 9. Potential complications of untreated TB. If left untreated, TB can lead to some very serious complications. One of the most common is permanent lung damage, which can make breathing difficult and impact your quality of life. The bacteria can also spread to other parts of your body, like your brain, spine, or heart, causing even more severe problems such as TB meningitis or TB pericarditis. These complications can be life-threatening, which is why early diagnosis and treatment are absolutely crucial. Outrow. Stay informed, stay healthy. Thanks for watching. If you found this information helpful, don't forget to like, share, and subscribe for more health updates. Stay informed and stay healthy.